Many important physical functions are dependent on regular exercise and movement. Elderly people experience a reduction in physical functions even after 24 hours lying in bed. Lack of movement can, for example, cause respiratory problems, deficits in blood volume, problems with joints, and mental problems. This often triggers a vicious cycle. The motor-driven movement therapy device, Motomed Letto 2 leg-arm, provides excellent support during physical therapy and can be used on either side of the patient's bed. The expandable chassis and the 4 brake stop secure the device to the floor so it doesn't have to be affixed to the bed. Large safety foot shells and leg guides ensure safe and secure fixation of the feet, allowing movement therapy even for paralyzed or coma patients. The calf shells can be adjusted exactly to the length of the patient's leg. The TrainCare leg guides permit comfortable insertion of the legs, holding them safely and inhibiting lateral movement. Flexible and individually adjustable straps on the calf shelves avoid the overstretching or blocking of knee joints. Conscious patients can follow their training data on the display and can adjust their training settings independently. The range of bending and stretching can be adjusted while the patient's feet are inserted, either manually or electrically, as shown here. The passive speed can be adjusted from 1 to 60 revolutions per minute. The smooth passive motion helps to maintain muscle tone and joint mobility. It supports blood circulation, improves bowel activity, and reduces muscle tension. The Motomed software monitors muscle condition during the training session. At the slightest sign of a spastic cramp, the Motomed SpasmControl automatically stops the pedal rotation and smoothly reverses the direction, alternating back and forth until the spasm has eased. The Motomed provides 3 different therapy modes. Firstly, the passive motion to loosen the leg or arm muscles. Secondly, the motor-assisted servo cycling feature, which allows for active pedaling even with minimal muscle strength. And thirdly, the active assisted training against adjustable resistance levels. This helps to enhance strength and endurance in preparation for standing and walking. For upper body training, the movement therapy device Motomed Letto 2 leg-arm trainer can easily be positioned on either side of the bed. The floor fixation locks it securely into place, while various adjustment options enable it to be adapted to any bed height or width. There's a choice of several different hand grips and arm shells for the comfortable fixation of the hands and arms. Patients who are able to grasp may use special wrist cuffs to support their hands without having them completely strapped in. The passive speed can be adjusted from 1 to 60 revolutions per minute. The smooth, passive motion of the arms helps to maintain muscle tone and joint mobility and reduces muscle tension. Conscious patients can actively start turning the handles even with minimal residual muscle strength. There are 20 resistance levels that can be smoothly adjusted according to the patient's condition. This specifically strengthens the arm, upper body and respiratory muscles. The special Motomed movement protector monitors muscle condition during training. At the slightest sign of a spastic cramp, the Motomed SpasmControl stops the arm pedals and smoothly reverses the direction, alternating back and forth until the spasm has eased.
Generally, this is applicable for all types of patients. Basically, every patient can be trained with the Motomed, provided that the arms can be moved freely. We are using it to maintain the mobility of the upper extremities and to train the respiratory musculature.